Well, guys, switching gears here, we on the line this morning we have Dr. Tyson Green. He is with the Centers of Orthopedics in Lake Charles. He joins us now. Give us 1 second with these. We're having some. Okay, I think it should be good to go now, correct? There we go. Perfect. Awesome. Wonderful. He joins us now. Thank you so much. We were talking a little bit in the break here, and you had mentioned that you actually were there when Hurricane Laura hit. Talk a bit about that experience and kind of what you went through, as well as the patients and your other coworkers.
Yeah, it was not by choice. I mean, we definitely wanted to get out of there, but a lot of the time, we don't have that option. Both the doctors and the nurses that, had to stick around, with the patients. We rode it out. We were in the hospital. We had windows blown out and trying to keep the patients calm and safe in the hallways while we're trying to close off windows and doors. It's just a horrific experience for the patients, and not much better for the healthcare workers either. Not an experience I want to live through again.
And something that you had mentioned as we were talking, these patients, a lot of them are scared. They're not really sure kind of where to go from here. And it's the same situation for a lot of doctors and nurses. I mean, some of them are still without power, without homes. I mean, it's a pretty, scary time, to say the least.
Absolutely. Absolutely. The patients that think about having surgery right before the storm hit, you have stitches still in there, you have an incision to care for, you have a cast on. At Center for Orthopedics, we have a lot of patients that just went through surgery right before, and we don't have anywhere to practice, and the hospitals are closed, and only for emergency services, which even that is very difficult without power and without water. So the surrounding communities having their help and taking care of these patients without question would be greatly beneficial. These patients are scared; they don't know where to go. Some of them, are really, really fresh off surgery. And even though we try to get in touch with them and try to take care of them as much as we can to get them other care, they've evacuated. They're in other cities and towns around us. So definitely helpful. As far as the nurses and the doctors, we're still required to get to work, and we're still required to do our jobs. And a lot of these nurses, they don't have homes. A lot of the doctors, we don't have homes to go back to. So we're in temporary living situations and without power, without water. So it's just a lot of prayers and a lot of help needed here.
And before we go, real quick, that was my last question for you. What can people do to help? I know that so many people would love to help in any way that they can.
Well, I think we've had such an outpouring of the surrounding communities of bringing supplies and feeding the workers and people here. It's going to be a long process. The things that we can help with, that you can help with right now, any help is appreciated. But remembering that this is not going to be over by next week. It's not going to be over by next month. It could be months before we're really back to normal. So the surrounding communities, caring for the patients that have been displaced, understanding that the healthcare workers, especially our nurses, are still really, really working hard to get to work and take care for our patients here. Definitely help them out in any way you can. I think that the help of coming in from out of town and giving us all the different stuff that they've given us is good, but I think that we need federal assistance. We need a lot of help over here.
Right. Well, listen, we will do whatever we can to help and make that happen for you guys. Thank you so much for joining us. We really appreciate it, and hopefully we will be in touch soon. We'll be thinking about you guys.
Thank you for bringing awareness. I appreciate it.
All right, guys, coming up.